So we're going to go ahead and get started with a guided meditation. And it's an easy way to have everyone feel how easy it is to get peaceful inside. So if everyone can just get in a comfortable position. Now, this time at first, keep your eyes open and just notice an object that's in the room that you're in. Just really look at that object. Look at it like you've never seen it before. Notice the details of the object. So just take a minute to actually look and investigate the object like it's the first time that you've ever seen it. Now we could gently close our eyes and visualize a candle flickering in a dark room. And try to imagine it as vividly as possible. See the flame burning. Take a minute to try to see if we could expand that, to use your imagination to visualize the scenery. So it could be anything that you want. It could be just something peaceful. It could be mountains, could be a beach, a stream. It could be a rainbow in the sky. Just notice when you do that, you focus the attention inward, your possibilities are limitless. Change it over and notice what you're hearing that's outside of yourself. Any kind of sounds that you hear, whether it's wind chimes or birds chirping, clock ticking, any sounds that you hear outside of yourself. Your awareness inside. Notice the stillness and how quiet when you bring your awareness inside that you could be. We're going to focus on the sense of touch. So just feel anything that's in contact with your body. It could be the chair, your clothes, jewelry, your hair. And then let's focus the attention inside. Notice any feelings inside. What's the feeling of your breath? The feeling of your heart beating. It feels when you do focus that attention inward. Something that can be done at any time. It's just a quick way of getting that peaceful feeling, especially in times of stress. When you're ready, you could gently open your eyes. And I want to thank you all for participating. And I'll pass it over to Dr. Gerry.
Good morning, good afternoon, everybody. And I got to give you all a little bit of coroner humor. As you know, I'm the coroner in Jefferson Parish. I just went through that exercise. I started with the flame, and then I imagined somewhere beautiful, like she said. And I thought about where we typically go in the summer, which is Croatia, and we go on a boat. And I look at the countryside, and the first thing that jumped in my mind was 2 summers ago when the whole side of the mountain was on fire. So that's my coroner humor. The flame turned into the mountain fire. and I lost it after that. So, but thank you for the intro. I'm excited to talk to y'all. I've been the coroner in Jefferson Parish for 9 years. I know a lot of the folks on the call know me. As odd as it may sound, I really like the job. It's challenging, but in this past year, the challenges have been quite different. Our office is, everybody knows death, but I'd like to tell you a little bit about what I do. The office has is 24 hours a day. We do death investigation. Our job is to determine cause and manner of death, who needs an autopsy. We get about 3,000 cases per year reported to the coroner's office. Of those 3,000, we wind up doing about 600 autopsies. What qualifies as a coroner's case to need an autopsy? It's every suicide, every homicide, every accident, overdose, child death, deaths within 24 hours of hospitalizations, deaths of people who don't have a doctor, deaths in public, anything suspicious. Those are who we bring in for autopsies. Out of those autopsies that we do, 600 a year, about 60 or 70 are homicides. We have about 50 suicides a year. Last year, we had 150 overdoses. This year, that number is going to go up. We're on track to do 250 overdoses this year. So it's a dramatic increase in overdoses, probably a combination of the fact that we have more dangerous stuff on the street these days, plus the COVID crisis. Next department we have is sexual assault. We're in charge of doing evidence collection, which is rape exams in all sexual assaults for the parish. And last but not least is our mental health department. That's probably the busiest department in the coroner's office. And what we do there is anybody who needs to be brought into a facility against their will or kept against their will kind of runs through the coroner's office. To give you an idea, that would be orders for protective custody, PECs, which is physician's emergency certificates, and OPCs, which is, and CECs, which is coroner's emergency certificates. That is continually getting busier. For example, in 2017, we had 13,000 calls for service in that department. And this year, we're on pace for about 2,000 calls for service. So it's constantly getting busier. It's, every year. And in that department, we see, it's a lot of a crossover. We have, it's mental health. We have a lot of crossover with substance abuse in addition. So it really complicates things, and I'll talk a little bit more about that later. The last thing, which is something most people don't know about the sheriff, is normally if your company gets sued or is in a legal issue, the sheriff comes and serves you with whatever papers you need to get served with. Well, when the sheriff gets sued, it's my office that will actually go and serve the sheriff with their lawsuits. And last but not least, if anything ever happens with the sheriff and he or she needs to be arrested, it's the coroner's job to arrest the sheriff, which is an odd distinction. So let me move on to the topic of the year, which is COVID and how it pertains to my office. COVID is a coroner's case, but not for the reason that most of you would think, okay? It's just like hepatitis or AIDS or HIV. These are what's called reportable diseases, okay? And they need to be reported either to the state DHH or to the CDC or both, okay? In most cases, we don't need to autopsy them because we already know the cause and manner of death. It's just important that we know nationally and locally how many cases we have. So typically what happens is these cases, the hospitals will call us and say, hey, we have a death from tuberculosis or COVID in our case. And we take all the information we need. And at that point, we release the body, which means that the funeral home can come and pick the body up and work with the family on services. With COVID, it's gotten really different and difficult because we would do our normal process. We'd take all the information we need. Our job is done. We release the bodies, okay? But we actually wound up getting a crisis because the hospitals would call us back and say, hey, the funeral homes won't come pick these bodies up, okay? So, reasons for that, the funeral homes, didn't know what to do with the bodies. They didn't know what they could do with them. They didn't have enough PPE to handle bodies safely. So I understand this. And last but not least, a lot of these families want services, and we're told, look, you can't have it now. You might be able to wait a few weeks. So a lot of families chose to wait to get services, and funeral homes typically don't have the facilities to refrigerate a lot of bodies. So the hospital morgues filled up. They called us, and we started taking bodies. Now the coroner's office in Jefferson Parish, we can take about 75 bodies in our morgue, and we got to capacity relatively quickly. So what we did was we got a refrigerated truck. We took it to the Jefferson Parish facilities. They built shelving in it for us, and it was able to hold an additional 38 bodies, which got us through that initial COVID crisis. Another interesting thing about the COVID was when we had all the initial wave of COVID, we were seeing probably an average those first couple of months about 10 deaths per day in Jefferson Parish. But also, in addition to those deaths, we saw a significant increase in non-COVID deaths, meaning if we take the COVID deaths out of the equation and look at the number of people dying, we were about 30% higher than we would normally expect our deaths to be. Now, some people could say, well, that must be COVID cases that you guys missed. I don't think so. I think more than likely what these are is people who would not be able to go in to see their doctor because the doctor's office was closed. Remember, in the beginning, they were only seeing people virtually and things like that. A lot of people were deathly afraid to go seek care because they didn't want to catch COVID. And a lot of people were thinking that, look, the hospital is too busy taking care of COVID patients to take care of my problem. So we started seeing a lot more deaths and a lot of people dying at home. So it eventually got to the point where as COVID deaths went down, those deaths attributed to the situation kind of stayed stable. So at one point, we were actually seeing more deaths because of the measures that the system had to take than from COVID itself, which is why it was great that the healthcare system was reopened and brought patients back in. Now we're pretty much close to normal with our deaths per day. The summer COVID increase that we just went through did not have a significant spike in deaths. I think only twice did we have more than one death per day, and in most days we didn't even have any. So I think that's because I think the virus is possibly not as strong as it used to be. I hope, and most definitely our healthcare system is much better at taking care of COVID cases now than they were a few months ago. They found out what works, they found out what doesn't work, and we're seeing the results of that in outcomes. So I want to move on to talk about two things that frequently overlap. They're both very impactful in my office, and that would be mental health issues and substance abuse. These are not new issues by any stretch of the imagination, but they are both most definitely worse during this COVID time that we're living through. They're also hugely impactful to our employers and the economy, on top of all the other COVID issues with the economy. So it's natural for us to realize that the mental health issues are going to be magnified during the shutdown. I mean, we're seeing people have less access to treatment. They have a significant increase in stress and depression and other mental health issues. And so it's not surprising that we're seeing the results of that, whether it's mental health crisis like we see at people calling our office, or the police calls for increased domestic violence and child abuse and things like that. In addition to the mental health side, we're seeing a pretty dramatic increase in substance abuse. It's mostly alcohol, but there's also other drugs involved like benzodiazepines, opiates, and methamphetamine. Opiates are your prescription pain pills, very frequently abused: Vicodin, Lortab, Percocet, OxyContin. You got some injectable opiates like heroin, which is illegal, morphine, Demerol, and fentanyl. There's a legal fentanyl that's used in anesthesia and for chronic pain and patches and things like that. Then there's the laboratory-made synthetic illegal fentanyl. And this is mostly made in China and Mexico. It's cheap to make. It's unbelievably potent, probably 50 times more potent than morphine, just to give you an idea. And it's injectable, but even worse than the fact it's injectable is they've figured out a way in the last 2 years to put it into pills. So now a lot of the, because it's, look, with the prescription monitoring program that not just Louisiana, but most states have, it's very difficult for people to doctor shop and get too many pills from doctors. So people are going on the street to buy pills, and they're buying what turns out to be fake fentanyl or Xanax or Percocet, and it has fake Vicodin, Percocet, or Xanax, and it has fentanyl in it. Okay, and the problem is, these drug dealers, they're not pharmacists, so they don't know how much fentanyl to put in, and people don't know how much to take, which kind of makes it not surprising that we're seeing so many more deaths in these last few years from the opiate crisis. And remember, I said like last year we had 150 overdose deaths. We're on track this year for 250, and last year it was up, but not nearly as much as this year. So why is all of this so important to our business community? I'd say the odds are most of you have either coworkers or employees who have one or both mental health issues or some sort of addiction issues, whether it's alcohol or drugs, or a combination of the two. These people, I think we know they're more likely to get workers' comp injuries. They're more likely to take sick leave. They're going to run up the healthcare costs for the system, which will cost a lot of money next year. They'll be unproductive, unhappy workers. It puts a huge impact on any organization's bottom line. But more importantly, it puts that employee, their coworkers, and potentially the public at risk as well. So yeah, it's a really big problem that we need to address. These people need to be identified. They need to be helped. Employers, I tell you things we want to look for to give you a hint that you want to start considering, does this person have a mental health or a substance abuse issue, would be mood swings, depression, aggressive behavior, inconsistent behavior, somebody who's stealing at work, anybody who has financial issues, if they've got a new onset tardiness or absenteeism, any obsession with pain complaints, seeing multiple doctors, drowsiness, anybody who's having significant mood swings, euphoria, depression, or anything like that, are people that we need to consider that they may be having issues. And in closing, I'll tell you, we all need to take this seriously, and consider mental health and substance abuse, when you see the abnormal behaviors that I just described, plus other abnormal behaviors. And I'd encourage everybody, if your organization or your company doesn't already have policies and procedures in place on how to address this consistently, that you do so ASAP. That'll do it. I'll take any questions and we can move on. Thank you.
Thank you so much, Dr. Gerry, for being today's featured speaker. I think if it's okay, we can let Chantrell start with the panel, and then as we're going through that, people can submit your questions to either the Q&A or the chat box, and we'll address questions at the end. So if you have a question that's for a specific speaker, whether it be Dr. Gerry, Chantrell, any of the panelists, or Jennifer, please feel free to just kind of put that in there, like who it's for, who you would like to direct that to. You can also ask general questions. So with that, let's kick off the panel.
everyone for allowing me to be involved. And to a special thank you to our panelists, Miss Daisha, Miss Vanessa, Miss Stefanie, and Miss Carrie Ann. Good afternoon, ladies, and let's go ahead and get started. First person on my list would be Miss Carrie Ann, employee burnout in the workplace. We've heard the metaphor that when you're on an airplane, putting on your oxygen mask first before you put on somebody else's. What would that look like in a workplace setting when it involves burnout?
Yeah, no, that's a great question. So one, I just want to say, I don't know how you guys feel about listening to Dr. Gerry's statistics and all of that information he just shared. But I know for me, and it's something that I deal with daily, I'm a private practitioner in the city. So, you know, I work with people who either have severe, well, probably not severe like Dr. Gerry is talking about, but who have daily struggles with mood swings or depression, even sometimes substance abuse. And so I know those statistics can be very overwhelming. And at the very least, very sobering for all of us to hear, especially when we think about how big it is, right? Like, this seems like such a big problem. How is little o me, how am I supposed to help tackle this issue? And so that's why I think this question about putting on the oxygen mask first is super important. Anytime we talk about mental health and we talk about the problems out there, we first have to be able to recognize them sort of in ourselves, right? Like that whole man in the mirror perspective. What's kind of going on internally in myself that might not necessarily need the coroner, right? Hopefully we won't go to that extreme. But at the same time, if I don't mitigate it, if I don't learn to manage it in the now, in those small waves, then when that big wave comes, it's going to definitely be a lot harder to do. And so when we think about burnout for our employees, we have to first be able to recognize burnout in ourselves. So when I think about my job, you know, and going to work every day, is that something I'm dreading? Or is that something that I'm looking forward to? Am I able to manage my time to where I'm able to attend to tasks outside of work, especially when we're thinking about either managers or, you know, business owners, right? Small business owners. I personally own my own business as a private practitioner. And so is my business the only thing that's on my mind? Because if that is, then I wonder how close to burnout am I? Because if it's something that I'm constantly thinking about, then I can't rest. And so when your wheels are constantly spinning like that, right, the idea that burnout is coming sooner rather than later is probably more factual. And so those are just a few things. But I think as you are sort of about to hear all of this information and some really great strategies and plans to put in place, to really begin to think first and foremost, right, like what am I doing? And then also, yeah, how can I implement these things little bit by little bit, right? Like it's not your job to get rid of all the opioid uses and you know, in your company. But it is your job to be able to spot mental health issues, and you do that by starting with yourself.
And that's a good point to make. And Miss Vanessa, what does burnout look like in an employee, not necessarily the employer, but then the employee themselves? And how would I be able to tackle that to say, I know this person needs help. What can I do? What should I be looking for?
Thanks, Chantrell. So how you would notice this as an employer in someone else, you're going to be noticing some behaviors. Like Gerry said, you can see some changes in behaviors. You'll see that they're not engaged at work. They're not answering emails. They're not returning phone calls. You'll see that their conversations have become more negative, and negative in a way that's not useful. You'll see that they're not necessarily going to be productive at their job and not effective at their job anymore. And it's going to look different for everyone. The World Health Organization actually calls it occupational burnout. And the way you identify it in yourself is that you're going to be able to see changes in your thoughts and how you're feeling. So you're going to be, you know, that overwhelm. You're going to be dreading when the boss calls. I don't want to answer the phone. You're going to be dreading, like Karina said, going to work. You're going to feel loss of energy. You're going to be exhausted. You're going to possibly be engaging in some escapist type activities like overeating, over drinking, over you fill in the blank, what your preferred vice is. You can be overdoing something to escape that feeling of dread. And it's not in a vacuum. You're going to absolutely have that experience at work trickle into your personal life, and your personal life is going to affect your experience at work. So we had a client that recently had was having a lot of issues at work, was overwhelmed. The company wasn't doing it right. The employees were lazy. They were incompetent. And then on top of all that, my wife's giving me stuff at home. So a lot of overwhelm. And when we did some mindful thinking, we were thinking on purpose, he discovered that he wanted to work on his relationship with his wife. And her main complaint was, they weren't having enough physical activities. And it was immediately right after the pandemic started, so around 2 months in. And what he started attributing it to, said, I'm tired and I'm older now. That's why that's not happening. I just want to go home, go to bed. And when he really thought about it, what was really happening, he was spending a lot of time watching the news, and the news was around a lot, not around his particular, was not positive towards his particular political views. And on his way home, he was listening to a lot of the political views that he agreed with. So he wasn't understanding why everybody was just doing it wrong. Very frustrated. So what he discovered is that he wanted to spend that time that he was watching the news to think of interesting ways to improve the relationship with his wife. And also on the way home, he was going to listen to, I think it was like soft rock. And that totally turned around his relationship with his wife within a couple of days, and it trickled over to work, where he was really enjoying conversation at work, and then grateful that he had a job, was providing for his family. So it really changed, and that's an example of the personal life really impacting the overwhelm in his professional life.
And that's a good point to make, and especially with the time that we're in, work is not always at the office. We are now virtual. We're sitting all here. We're actually in a virtual environment. So we have some that, of our workers that are at home, and then some that are actually at the office itself. And that can cause friction also. So for Miss Stefanie, how does a company help employees who are working remotely or the ones in the office and burnout, or how to avoid burnout and stay connected to each other? Miss Stefanie? Oh, I think she's on mute. Mute. I can't hear you. There we go. No. Would you like me to come back to you, Miss Stefanie? Nope. Okay, we're working on that. So, okay. So while Miss Stefanie's getting adjusted, let me ask Miss Daisha, why is it so important for employers to create a compassionate and caring workplace?
Yeah, so I think it is really important because I think now more than ever, when people are seeking employment, they're not just seeking something that they enjoy doing, but they're also seeking an environment where work-life balance is prioritized and where they feel like they're valued and heard. So like Vanessa mentioned, our work and home life often tend to merge a lot. So being able to have that balance and not solely just be, okay, I'm this employee who works from 7:30 to 4, and that's all my employer sees me as. But they also recognize that, hey, I have a social life, I have family, I have financial issues. And so they are prioritizing my health and well-being in addition to making sure that my work is being done as productive as possible. And so I think when employees really know that, hey, I'm valued here and I feel like I'm a part of a team and there's open and honest communication and we have mutual trust within this organization, they truly do feel like, hey, I can put my all into this job, still knowing that at the end of the day, I am a person, and if something is going on, I can feel open and honest with my supervisor or manager, and they will actually care about what I'm going through. And it won't just be, okay, well, you need to get your job done. So it's kind of having that balance of, yes, I am putting my all into my job and I'm being productive, but also my employer recognizes that, hey, this is a person and we need to take care of them as a whole being and not just as this worker who's here until 5 o'clock and then we're just done with them. And so I think that's one of the reasons why I really like to see organizations implement workplace wellness programs, because it really does show that you care about the person as a whole. It promotes those resources and best practices for both physical and mental well-being. And those are things that, yes, I can participate in those activities or use those resources at work, but I can also use them at home. And I think with so many people working remotely, that's so beneficial, because work and home, those lines have been blurred so much throughout all of this that it's like, okay, am I really taking care of myself? Am I able to just disconnect from work at a certain point and not feel like, okay, well, my computer's here, so let me just go ahead and send this last minute email, which, you know, it really does help to create those healthy boundaries that we all need, because at some point you do have to disconnect and take care of yourself so that you can be at your best and be your most productive. So I always try to remind people, you know, implementing workplace wellness, a lot of people hear it and they think this is going to be super time consuming, it's going to be a huge financial burden, and that's just not really the case. There are things that you can do that don't take a lot of time, that don't take a lot of money. I worked with a small community college recently, and they implemented just very small changes. They started doing a Who's Walking Wednesdays, and they all got together on Wednesdays and they'd walk around the campus. They started sharing healthy recipes and ended up putting together a healthy recipe book. The HR director went and found different stress management resources that she sends out, and they would get on Zoom calls and practice guided meditation and stress management, deep breathing, and those types of things. And so I think it's really important to get that leadership buy-in so that people know that that organization truly does care about them, so that they are putting their best foot forward. So I think that's why it's so important to have that compassionate and caring workplace.
And that's a very good point. Ms. Stefanie, we're going to go back to you.
Can you hear me now?
We can hear you perfectly now.
Good. I'm so glad. All these
And,
technical difficulties. I want to kind of piggyback on the whole theme of put your oxygen mask on first.
Yes, ma'am.
And I'm of this panel, I'm the only HR consultant. So from the perspective of your workplace, first of all, remote work is here to stay. We've been asked that a million times. We were seeing that trend even before COVID. And then we have to understand that this is an unprecedented time in our history. There are stresses both at home, and as employers, you have no idea, unless you do show interest in your employees, what has been happening with them. Have they had family members that have been ill, or God forbid, they passed away? Substance abuse issues, which Dr. Gerry alluded to. So those employees that are working remotely have the added stress of being disconnected from the workplace and not knowing if they're still valued. So when you talk about put your oxygen mask on first, to me, it's best practice. And what that means is the employers have to put their oxygen masks on first and be ready. All the small businesses in town have been getting all kinds of guidelines and helpful hints, anywhere from the local chambers to business alliances and associations on how to heed, number one, safe working conditions, remote being kind of the most dramatic because you're not interacting, but that's causing other problems too. To have a leadership team, number one, that's compassionate, flexible, trusting. There's enough workplace burnout, which the definition, if you're looking at workplace burnout, is someone that is so mentally exhausted and doesn't feel appreciated and is starting to feel like they're not competent in their job. So with your employees being your most valued asset, how can you, and hopefully you had a program before COVID of checking in and progressive performance, and also being aware of how healthy your employees are. I think it's even more imperative now that there is a game plan and that you are checking in with those remote employees, deciding who it's appropriate to be remote because of their family situations, health situations, or the job they do. Obviously, you're not going to have a wait staff person working remotely, but if you have an accountant that works in your restaurant, that would be appropriate. But they also want to remain to be part of the team. And there are exercises that can be done. You can do periodic meetings like we're doing right now. You can do coffee time. I love Daisha's recommendation about getting together and doing some wellness initiatives, whether that's walking. Some community outreach is always great as well. The staying connected is the key, and having your employees feel that they are still valuable, still invested. And look, there's many workers out there, they don't want to just do the same thing every single day. They're still hoping that they're going to succeed and that they're going to be allowed to be creative and move forward in their careers just because they're working at home. And then on the other end, from the employer's perspective, if you do have concerns about how am I going to monitor this? How am I going to make sure that deadlines are being met, or that we're producing and we're creating the product, well, check in with them. You should have some kind of both verbal or written policies, as Dr. Gerry was saying, that this is the time to really have those guidelines in place so people know that are working for you what the expectations are, but also being flexible with those that have children at home or are homeschooling or have other demands. I'm reading a book right now, and it's so telling, and it's called In Praise of Wasting Time. And when we did that exercise of meditation, which I try to do every day to meditate, when you just move away from something and allow yourself to either take a walk or sit and be thoughtful, you're going to be so much more productive in your daily life. Well, the same is true in the workplace. And there are all kinds of resources that this panel has suggested. If you have an employee assistance plan, it covers even more things than just wellness. And look into that, or other resources that the city and your parish is providing. Really look into that for your team.
Thank you. And that's actually good information to have. And Ms. Vanessa, following along as a follow-up for Ms. Stefanie's answer, how can supervisors or employers themselves remove that stigma of mental health? Because we understand, we know some people may need help, but no one wants to be classified as needing that extra guidance. How do you think we can remove that?
Well, the stigma from mental health really comes from when you think of someone with a mental health problem, that they're dangerous. So really talking about what mental challenges can look like: overwhelm, not being able to focus at work, or just don't want to engage because you're too much inward. Really talking about it at team meetings. Here are the resources that we have. We encourage you to use them. These companies pay a lot of money to have these resources for their employees. Really talking about them during meetings, and being very clear that we want them to use it. Because if it's something that's not talked about, it'd be implied that, you know what, it's not something we should use. That'll be looked at as being weak. There's always someone who uses is a mental health champion in a larger corporation. Have them share their story that they want to share. If a manager has used the resources, when you go through a divorce, when you go through this pandemic, it's very disruptive. If you go through something disruptive like this, sometimes you need some help because it's a lot of changes at one time. And giving those resources, the information, how to use it, how much it costs, really just opening that conversation and constant conversation about it, not just one time when the HR professionals come in the fall to get you to sign up. Have it to be a constant conversation at the workplace.
And that's good. That's something that we all needed to know. And we're starting with that about creating policies. Miss Carrie Ann, what does good mental health look like for business owners?
Yeah.
Mhm.
So one, I put a flyer on the resource page, and I'll just put a link in the chat box. So that's actually a direct link to the flyer also on my website. But I love how Vanessa said it's a constant conversation, because I think a lot of people think about mental health as something that, okay, I checked the box off and now it's sort of one of those tasks that's done. And mental health isn't sort of, unfortunately, I don't know if that's the correct word to use, but it's not one of those tasks that's ever going to sort of be done, as much as it's something that's going to always need to be checked on, right? And so personally, when we think about owners or managers, you really want to have sort of a mental health game plan that's something that you can refer to pretty periodically, right? Like sort of a weekly check-in with yourself, if you will. And so that's kind of why I made this really simple sort of worksheet. Well, it's a flyer, right, that you can kind of look through to sort of ask yourself these 5 basic. Now there are others, right? I mean, you could probably Google something, you know, if you were looking for a mental health checklist. Or also just, you know, any of us on the panel, I know any of us would be willing to have an individual conversation with anybody interested in having a conversation like that. But these are things that I think are really helpful just for owner or manager, is really the idea of like building a solid foundation. So you can ask yourself, right, like what processes, manuals, paperwork do I already have in place? And I know that that can seem like a mountain, right? Like if you don't have anything, that mountain feels giant. And so really the biggest thing here is you want to think about, if I can clearly figure out what my expectations are, what my boundaries are, these things can help me sift opportunities, and they can create clarity that I can have confidence in, right? And so sometimes it really just looks like building a foundation for yourself. It might not be something that you publicize, right, like an employee manual, but it could be sort of this mantra that you have for yourself, right? Like it's a statement that you put on your bathroom mirror, you know, in an expo marker, right? And it's something that you can sort of use as a check-in to remind yourself what at the end of the day is something foundational that I want to utilize for my business, for my well-being. The second thing is going to be sort of this idea of practicing rest, right? So as Stefanie was talking about, as Jennifer led us in that mindfulness exercise, right? It's something that we're not used to, but it's huge for us to slow down and recharge. I want you to think about every device you own has a battery, which has a lifespan, right? And so it's that same idea for us, is that we have to recharge so that we're not spinning our wheels. And really, when you spin your wheels, you're using more time and energy and resource in the long run. One of the things, right, when you think about practicing rest, is that idea of your phone. Our phone represents so much these days because it has so many capabilities. And so when is the last time you ate lunch without your phone? Right? That's a really good question to ask yourself. I mean, probably for all of us on this panel, that's really hard to answer if we want to be honest, right? And so to be able to have lunch, 15, 30 minutes, I'm not asking you to commit this whole hour if that sounds too hard, right? But to give yourself a solid 15 or 30 minutes, really they say 20 minutes is sort of a good roundabout number, right? To let your mind rest and not be stimulated by competitors, right? Not be stimulated by really just that sort of scrolling mentality where you're sort of doing something mindless, or even the sense of sometimes our phone can represent like a business deal happening, which is a risk that can be rewarding, or the phone can also represent the sense of like a huge disappointment. And so giving your mind space to be free of those things for a set amount of time. If you want to use your phone to set a timer, right? Put it away and then go get it when the timer goes off. A third thing to really do is ask yourself about priorities, right? Do I know the difference between a project or an emergency, something that's immediate or something that, right, or the idea of urgency are important, right? And so it's a very simple matrix. You can Google Eisenhower Matrix, right? And they talk about the idea of putting things in 4 categories. I think sometimes as a manager, and especially as a business owner, we can get in that mindset that everything is important, right? And so I need to sort of attend to it all in this moment. And so this is really the idea of learning how to prioritize and make lists, and to, again, be able to put something aside, knowing that you can get to it or that you can delegate. Because, you know, we all love to ask for help, right? And so being able to really delegate something that doesn't feel as urgent or as important, right? You can delegate some of those things that are less important. And so sort of letting go of some things. The 4th thing would be values. And I think this is really key, because the values that you use to measure yourself are going to be the values that you use to measure your employees. And so if you value productivity over quality, right, then that's what you're going to expect of your employees. And I'm not saying that's right or wrong, right? We'll be neutral about that. But if you don't know your own expectation, then you're not going to know what you're actually expecting your employee to do, which means clearly communicating that, and also knowing, you know, what does your employee think about that? That doesn't mean that you have to sort of bend to their will, but it is helpful to know, well, is my employee one of those who's going to comb through something and sift it really well, right? And it's not necessarily about quantity as much as it's quality. That's helpful to know, right? And so for you to be able to do that for yourself. And then sort of the last thing on my list, right, is the sense of play. And the quote that came to my mind was actually from The Shining, right? What is it? All work and no play makes Jack a dull boy. And I was like, oh man, that's like, and then he goes crazy. So don't do that, right? Make sure that you have some time to yourself to really get away and enjoy the scene, right? Like, nature is beautiful. Go to a park. Take your family out, enjoy a takeout or a restaurant if you feel confident in that space, right? And so to be able to give yourself permission to get away, because if you're not giving yourself permission, then subconsciously you're actually not giving your employees permission either. And so every time they do something that looks like not work, right, it's going to trigger you, which anytime, I don't know about you guys, but anytime I'm around someone who's constantly on eggshells, that's exhausting. Right? And so knowing that your mental health is creating an environment. And so what environment are you creating? And I think the biggest thing that I could say to business owners, and this has sort of already been said in so many ways, is the idea that mental health really is a business asset. You have the ability to put fuel in your company that's good and healthy fuel, that's going to produce results in the long run, and we can, let's call it that, an asset, right? Like you're gonna gain capital from it if you just put the work in it now. And you have to remember, this is sort of the long-term plan. This isn't going to be one and done or a short-term plan. It's going to be sort of that weekly check-in that you can do for yourself in order to begin to do for others.
And that's all very, very good information. And it starts with small steps.
Yes.
And the small steps that, as the employer takes on, can cascade down to their employees. And we have time for one more question, Ms. Stefanie. Piggybacking off of the answer of foundations, how can employees work with their employers to create a foundation for having that open space? To talk about difficult issues, workplace safety, inappropriate behavior. How can that be manifested and how can it be maintained?
So I am going to make a statement that doesn't just relate to mental health. And it was the headline of many stories before COVID was even an issue. We were seeing all of these allegations, accusations of sexually inappropriate behavior in the workplace. And one that comes to mind is an employee said, if only there had been somebody to talk to. Number one, I feel that businesses totally underestimate, undervalue what human resources can do, or someone in the organization, whether you have someone that's in-house or you bring them in on a regular basis. Hopefully they're not just coming in to sign the papers for benefits. It should be a trusted person that the employees feel safe to go and talk to with no repercussions or retaliation. You are not going to find out if employees feel that the behaviors of their coworkers, clients, customers, and the public are a positive one or a negative one if they don't feel that they can come and talk to someone and that there'll be accountability and some action, some remedial action. Because again, it's one thing to go and talk to someone and feel like it would be futile to do so because there's not going to be any reaction. So there has to be a space at work where you spend most of your time, whether that's remotely or not, where you do feel safe and included and free to speak. Where does that come from? It comes from management. So I go back to, what are the expectations, not just of what you're producing or what you're serving to your customers, but what are the expectations of behaviors and how you're going to be treated? The bottom line is with respect and dignity. If someone is fearful that they are really struggling right now and they don't feel as productive, they're tired, they're burned out, if you don't have someone there that they feel they can talk to that's going to understand and be empathetic, flexible, find solutions, then they're not going to come forward. And it's just going to fester and it's going to become worse. And that's where we get toxic work environments where the employer is putting, again, I think we've heard it from several of you on the panel, productivity instead of personal mental health first. Because if you don't feel invested, if you don't feel that you are appreciated and that someone actually sees you, then you're not going to be productive. So that's going to come from leadership and an understanding. And I go back to an experience that I actually have, not as a healthcare provider, and I think I shared this with you all, but when I was the executive director of employee relations at Tulane post-Katrina, as the employee relations director, not the person that was implementing health benefits or directing people to EAP, I was seeing people that were so disenfranchised, going through so much trauma, so much angst. They were so overworked. And just like with COVID, there was 25% of the workplace back. So an employee felt like they were doing the work of 5 people. I recognized the need of employees to get together and share their mutual experiences with one another, first of all. And they began to realize, wow, I'm not alone in this. And I think that's very important for mental health. And also it increased their, their self-awareness that they needed to take a break. And so we had over 100 sessions with first responders and employees during that period of time. And it was incredible how much more value just having those sessions and creating them made the employees feel. And then at the aftermath, how they could more openly talk about things that they otherwise didn't feel free to do. That's going to come from leadership. Your business is only as good as your frontline managers. And I'm going to repeat myself, but have those written, have those expectations written. I mean, you're required by law under prohibited discriminatory conduct to have that in writing that you prohibit that in your workplace. Why would you not have something in writing, as Carrie Ann said, that if there's a mental health problem or you feel unsafe in your workplace, there should be a communication open that you can have an open dialogue and feel safe in doing that.
And that was a very, very involved answer. Not in a bad way. I mean, in a great way.
Sorry. Yeah.
No, for somebody that's on the outside looking in, it's very important. We have to work together. And to work together, we have to have those resources, having it in writing. How do we create that in writing? And that question actually goes to Ms. Daisha. What exercises and resources can be used during the workday to assist employees with managing stress, building resilience, preventing burnout? What's in our community that's accessible for us to use?
Yeah, so I think one thing, like Stefanie mentioned, I think first and foremost, we just have to make sure that leadership is on board and leadership is flexible to allow for these things. So some things that come to mind are, you know, making sure that, yes, your employees, obviously you give them a lunch break, but do they have time within their day to simply go and take a walk or get some exercise? And so I think making sure that you're prioritizing those types of things and sending out resources periodically. In the Summit Library, I sent a link for 100 office workouts, which can easily be done, no equipment. You can do them literally with your desk chair, at home, near your couch, wherever you are. So just making sure that employees feel empowered to even be able to do these things, I think is the first step. But then from there, I think just making sure that they know where are these resources located. So making sure they know if they have EAP programs within their insurance, their employee insurance programs. So I think all those things are super important. One free resource that I really like was created by the Navy Public Health Corps. And so it's mainly for resilience for soldiers, but it definitely has, you know, it can be used for anybody. And there are several different tutorials for different relaxation techniques, guided meditation, deep breathing, progressive muscle relaxation, and it walks you through all of those. And so I also sent that to the Summit Library because I think just making sure that you have access to those things. And like Carrie had mentioned, you're taking the time to rest and decompress and take a break and prioritize your own health and well-being is really important. So I think those are some of those exercises and resources that employees can use that will help to manage stress and prevent burnout and increase their resiliency.
Thank you so much. And I'd like to say thank you to all of our panelists for your wealth of knowledge. I know I learned something just sitting here for these few minutes. So I know for sure the other members learned something as well. Miss Alex, would you like me to give our local resources here at the coroner's office? Okay. Here at the coroner's office, Dr. Gerry did bring up our mental health services. We want you to know that our services are available 24 hours a day, 7 days a week, weekends and holidays. Here at the coroner's office, our number is 504-365-9100. That information will be in the resources section below, as well as a local service that we have in Jefferson Parish called Mobile Crisis Services. If anybody has dealt with them, they are excellent. And their phone number is 504-832-5123. And they are 24-hour service just as we are. We are here for our parish members. So if you have any questions or any needs, please call us and we'll see exactly what we can do to help. Miss Alex?
Thank you so much, Chantrell. We're getting a lot of thank yous to the chat box. It looks like right now there are no questions coming in, but I just want to thank everybody for attending today and for speaking. We are going to announce our door prize winners on social media, so keep in touch for that. And then that Summit Library link I put into the chat box as well. So if you just go to livewelljefferson.org, in the menu, we actually have a health resources page, and that's where the Summit Library is located. And all of your panelists today have been sending me tons of awesome resources, and we've linked them all there. So you can find more at that site. And then we did put up the panelists' contact info at the beginning, but what I'm going to do as a recap to this event is actually send out all the speakers we've had this week and all of the contact info. So for anybody that has registered, you will have access so that you can contact your speakers in case you have questions following these presentations. But I just want to thank you all for donating your time and your expertise to Live Well Jefferson. So thank you. And with that, that ends the 2020 Health and Wellness Summit. So we'll see you in our next event. Thank you.
Thank you.
Thank you.
Thank you.
Bye.